19 visible signs of kidney disease. If there is one organ that suffers in silence, it is the kidney, and the biggest problem is that most people only think about it when something has already become serious. The kidney is not just a filter, it is a center of balance for the body. It regulates fluids, participates in blood pressure control, adjusts minerals, influences hormones, and helps keep the blood clean and functional. And it does all of this without drawing attention. That is why kidney disease is often deceptive. It can progress for years, with few obvious symptoms. And when the body finally cries out, there has often already been significant loss of function. But here is the part that almost no one learns. The body leaves visible clues. It is not just one thing. It is a set of signs, repeated over weeks, that seem normal when viewed in isolation. In this block, you will see the first 10 signs. Those that can appear in the mirror, on the skin, in everyday swelling, in the bathroom, and in your energy level. And the rule is simple. One sign alone does not confirm a diagnosis, but a sequence of signs deserves attention and investigation. Let's get straight to the point. Sign 1. Puffiness around the eyes, especially in the morning. If you wake up and notice puffier eyelids, a swollen-looking face, or a heavier feeling around the eyes, do not treat this as something that is always trivial. The area around the eyes is sensitive to fluid changes because the skin is thin, and circulation there quickly reveals any imbalance. When the kidney begins to have difficulty maintaining the stability of blood and fluids, the body may start to store fluid in typical places, and the face is one of the first. An important detail: kidney-related swelling is usually more noticeable upon waking because you have spent hours lying down with fluid distribution different from when you are upright. If this swelling becomes routine, it is worth paying attention to the next sign, because they often go together. Sign 2. Swollen ankles and feet, with an indent when pressed. Now look at your ankles and feet at the end of the day. Press the skin for a few seconds and release. If a deep mark remains and takes time to disappear, it is not just tiredness. The body retains fluid for many reasons, but when this becomes a pattern and appears frequently, you need to consider that the system regulating volume and elimination may not be working at its best. Many people normalize it because they stand all day, it's hot, or they ate a bit more salt. But the kidney does not usually fail dramatically at first. It fails by accumulation, small losses of efficiency that, over time, turn into constant retention. And the more constant it becomes, the more your body tries to adapt. But adaptation is not health. It is compensation. Sign 3. Swollen hands and rings that no longer fit. If a ring starts to feel tight, if a finger looks thicker, if the hand feels heavy upon waking, this may be a sign of fluid retention that should not be happening so often. The hands are a thermometer of internal balance. They do not swell easily in people with perfect fluid regulation, unless there is a clear trigger. The detail is that many people notice this and try to fix it with natural diuretics, random teas, or extreme food cuts. But the goal here is not to mask the problem, it is to understand the cause. If hands and feet swell frequently, the body is saying, "My fluid control is not stable." Sign 4. Rapid weight, gain over days as if you were bloating. If weight increases rapidly over a few days and you feel your body is fuller, heavier, with clothes tightening, this may be fluid retention, not real fat gain. Fat does not appear that quickly. Fluid does. This type of gain may come with a bloated abdomen, heavy legs, and even a strange perception. It feels like I got bigger, but it doesn't make sense. This matters because many people feel guilty, cut even more food, follow extreme diets, and increase stress. And stress tends to worsen retention. Here the focus is this: a rapid change, without an obvious explanation, deserves serious attention. Sign 5. Foamy urine or bubbles that persist. This is one of the most ignored signs because it requires a simple action: looking. Urine with persistent foam, thick bubbles that take time to disappear, may indicate that something is leaking through the filtration system, often protein. You do not need to be a specialist to notice when the foam looks different from normal and starts to repeat. The point is not to become paranoid over one day. The point is to notice a pattern. If this sign appears together with swelling, eyes, hands, feet, the combination becomes even more important. Sign 6. Darker, more concentrated urine with frequent amber color. Occasional dark urine may simply be due to low water intake that day. But when urine frequently remains very concentrated, with a constant amber color, even with reasonable hydration, this turns on a warning light. The kidney plays a decisive role in balancing the concentration of what leaves the body. When this balance changes, you may notice differences that are not explained simply by, "I didn't drink enough." Another point, repeated color changes may indicate that the body is not discarding waste as it should, and that is not something to ignore for months. Sign 7. Itchy skin without obvious allergy. That comes and goes. Many people suffer from itching and try to solve it with creams, moisturizers, expensive soaps, changing detergents, changing fabrics, and nothing truly works. When the body's filtration is not efficient, waste products can accumulate in the blood and irritate the body in indirect ways, including the skin. The skin is a signaling organ. It reacts to what is circulating inside. What stands out here is itching without an evident cause, that persists or returns frequently. It is not a normal little itch. It is a repeated, uncomfortable sensation that becomes a habit. And when it becomes a habit, it usually has a systemic origin. Sign 8. Pale, dull skin, without glow, with a tired look. Healthy skin usually has vitality. When it becomes dull, pale, with a washed-out appearance, and this does not improve with sleep or vacations, it is worth investigating. The kidney influences processes that affect oxygenation and internal blood balance. If the blood does not have the same functional quality, the skin shows it. And here is a detail. Some people do not notice a pale face, but they notice it in the overall picture. More pronounced dark circles, less rosy lips, hands without a healthy color. When the body begins to lose visual vitality without a clear reason, it is communicating something. Sign 9. Deep, persistent dark circles, even with rest. Dark circles alone are not a diagnosis, but there are dark circles that change the facial pattern. They become deeper, darker, and do not improve with rest, hydration, or routine changes. When this happens together with fluid retention, especially around the eyes, the sign becomes stronger. Because you may be seeing two things at the same time: altered local circulation and fluid imbalance. People usually think, it's age, it's genetics, it's stress. It may be. But if it is associated with other signs, ignoring it is a risk. Sign 10. Constant fatigue, weakness, a battery that doesn't recharge. This is the sign that most destroys quality of life, and at the same time, the one people normalize the most. Constant fatigue, a feeling of heaviness in the body, weakness, discouragement, lack of energy that does not improve even after sleeping. This is not simply a busy life. When blood filtration is compromised, when minerals and fluids become unstable, the body enters an economy mode. It reduces performance to survive. And then, real life shows up. You need coffee to function, you feel sluggish, you don't perform as before, you lose motivation. And you think this is normal. It is not normal to live without energy. Ingrin. Sjuårsröventsatsen tuort indrin insfleven. Decreased urine output. Many people pay attention only to the color of their urine, but ignore something just as important: the amount. If you notice that you are urinating less than before, even while drinking fluids, this may indicate that the body is retaining fluid instead of eliminating it. At first, this reduction is subtle. The person only notices that they go to the bathroom less. Over time, this can become more noticeable. Healthy kidneys regulate volume with precision. When this regulation begins to fail, the body holds on to what it should discard. Sign 12. Frequent urge to urinate at night. Getting up once at night can happen. Getting up several times, on a regular basis, is not normal. When the kidneys lose efficiency during the day, the body tries to compensate at night, when you are lying down and circulation changes. This strains the urinary system at a time that should be for rest. The result is fragmented sleep, fatigue the next day, and a silent cycle of wear and tear. Sign 13. Muscle cramps, especially at night or upon waking. Frequent cramps are not just a lack of stretching. The kidneys help regulate minerals that are essential for muscle contraction. When this balance is lost, the muscles suffer. Cramps in the legs, feet, or even hands, especially at night or in the early morning hours, may indicate a persistent internal imbalance. Many people try to solve this only with random supplements without looking at the cause of the problem. Sign 14. Restless legs. Sensation or discomfort at rest. The so-called restless legs sensation is often attributed only to stress or anxiety. But when it appears together with fatigue, cramps, or urinary changes, it may indicate that the body is not able to maintain neuromuscular stability. The discomfort arises precisely when the person tries to relax, and this disrupts sleep, recovery, and energy the next day. Sign 15. Loss of appetite or aversion to certain foods. Loss of appetite is rarely seen as a kidney-related sign, but when metabolic waste begins to accumulate in the blood, the body naturally reduces the desire for food. It is a protective mechanism. The person starts to snack, feels mild nausea, loses interest in full meals, or notices that they feel satisfied with very little. This is not dietary discipline. It is the body trying to adapt to an unbalanced internal environment. Sign 16. Persistent bad breath, even with good hygiene. Constant bad breath that does not improve with brushing, flossing, or mouthwash may have a metabolic origin. When the body cannot eliminate waste properly, part of it ends up being expelled through the lungs and saliva. The breath takes on a different, metallic or strong odor that quickly returns after hygiene. It is an uncomfortable but important sign. Sign 17. Easy bruising or purple spots. Bruises that appear easily, even after minor impacts, may indicate changes in blood quality and vessel integrity. The kidneys influence processes related to circulation and the maintenance of internal balance. When this balance is lost, the skin and blood vessels become more fragile. Many people associate this only with age, but when it appears together with other signs, it deserves investigation. Sign 18. Nail changes, ridges, fragility, or color changes. Nails are a slow but faithful reflection of the body's internal state. Deep ridges, brittle or dull nails, or irregular growth may indicate that the body is not receiving or properly using nutrients and minerals. Since the kidneys participate in balancing these elements, persistent nail changes may be an indirect sign of kidney overload. Sign 19. A general sense of a dysregulated body. This is the most subjective sign, and perhaps the most important. It is the feeling that the body is not functioning in harmony. Nothing is severe, but nothing is truly well. Poor sleep, unstable energy, swelling that comes and goes, slow digestion, discomforts that alternate. When the kidneys lose efficiency, the entire body goes out of balance, and this sensation often appears before any formal diagnosis. What most accelerates kidney damage in the modern world? The problem is not just genetics, it is the environment. Ultra-processed foods, excess sugar, inflammatory oils, low intake of essential nutrients, chronic dehydration, poor sleep, and constant exposure to toxins create a burden that the kidneys were not designed to handle for decades. The body copes for a while, but it collects the bill later. You do not need to have all of these signs. But if you recognized several of them, ignoring them is not prudence, it is risk. The kidneys give chances, they warn, they compensate. But when the limit is crossed, reversal becomes increasingly difficult. Paying attention early is not paranoia, it is self-care. And the sooner you listen to your body, the greater the chances of preserving something worth more than any treatment. Your autonomy and your quality of life. Of course, if you made it this far, one thing has become clear. The body warns before it fails. The kidneys do not break suddenly. They wear down in silence, while daily life goes on normally. Ignoring these signs does not make the problem disappear. It only postpones the moment when it stops being reversible. That is why now is the most important moment of this video. If you recognized several of these signs in yourself or in someone close to you, seek a trusted doctor as soon as possible. An early evaluation can make all the difference between correcting the problem in time or dealing with avoidable consequences in the future. If you want to understand what truly protects the kidneys, which silent habits accelerate damage, and which simple choices help preserve kidney function over the years, keep following this content. Share this video with someone you love, because many people are living with these signs without knowing what they mean. And if you want to receive more clear, direct content based on what the body really shows, subscribe to the channel. The right information at the right time can completely change the course of your health. Do not wait for the body to scream. Learn to listen while it is still whispering.